what if, okay, somebody is interested in doing the, fat grafting. What if they're not quite enough fat on their body? Or can you say they're not, their tummy isn't, that big? Can they get it from elsewhere? Or what would you suggest they do? Do they have to like maybe gain a few pounds?
Well, I have a good friend who is a big name in the fat grafting business, and he actually suggests to his patients that they gain weight. Now,
Oh.
yeah, I'm not 100% in favor of that idea.
Mm-hmm.
Because the increase in fat or the increased yield that you get after gaining weight can just as easily be lost if that patient should decide to lose weight afterwards, which they frequently will decide to do. I mean, the kind of fat that I think works the best is the fat that's resistant
Mm-hmm.
to fluctuations in weight, and there is fat like that. Fat cells will have either alpha or beta receptors on the surface of the cell, and these receptors have been found to be active in whether or not a fat cell will melt away, basically,
Mm-hmm.
with starvation and or exercise or diet, stimulation or exercise. And so I think it's helpful if you try to go after those fat deposits that are a little bit more of the abnormal fat that doesn't respond as well to fluctuations in weight or diet and exercise. Now, and my personal feeling is that these fat cells can most commonly be found in the hip area, in the abdominal area, in the upper buttock, low back area,
Mm-hmm.
and in the inner knee area, the
Oh.
inside of the knee. Now you can't get a whole lot of fat from down there, but if you only need a little bit of fat, like for fat grafting in the face,
Face.
for instance,
Mm-hmm.
then that could be a perfect little place to go and harvest a little bit of fat. But I think I have to say, in the spirit of completeness and thoroughness, that asking a patient to gain weight is
Mm-hmm.
one way that more fat can be made available. Fat is not the kind of graft material that you can borrow from someone else or
Oh,
that
darn.
is commercially available. So
Mm-hmm.
like now skin, different types of skin and skin substitutes can be borrowed or
Right.
bought basically. And what happens in those instances is that the skin would be harvested from a limb or from a cadaver
Mm-hmm.
and would be radiated and would be used in the burn industry, burn wound care. It can also be used in breast reconstruction and that kind of stuff. There's alloderm, which is a skin,
Right.
basically the skin dermal matrix, they call it, and so forth. But
Mm-hmm.
basically, most people have enough fat for small areas that of grafting, but they don't. If they need to have a large amount of fat, that could get to be a little bit of a tricky situation.